You've been diagnosed with a fingertip amputation. Here's what you need to know and a bit of what you might like to know. So a fingertip amputation usually happens when someone's using a knife or cutting a bagel and they chop off the tip of their finger. Often the wound is so big that we can't sew it back together. That's a simple way to deal with a wound, but if it's quite big, it's actually not effective to pull the skin back together and make a very tight wound. Instead, we leave it open and let it heal slowly by itself. And the wound will heal slowly by itself. It knows what to do, but it will take 2 to 6 weeks, depending on how big the wound was to begin with, before it heals completely. It may feel quite numb in the area while it's healing because there are nerve endings that have been cut, and those need to heal as well. Your family doctor will probably follow it, but in the emergency room we will probably put a bulky dressing over your finger where the tip has been cut off. So there'll be a big dressing covering your fingertip, and that's to protect the wound while it's healing. Now you can take it off after 48 hours, that's 2 days, but do keep it dry and leave it on for 48 hours. It will have been covered with some polysporin impregnated gauze or Vaseline type gauze to make sure that it doesn't stick to the wound too much. Take the dressing off at about 48 hours, take a look at it, put more polysporin on it, and cover it with a very large Band-Aid. And try not to get it bumped because you want to have it protected while it is healing. In the meantime, once you've checked it every day, you want to make sure that there's no increasing redness. So you want the wound to be getting smaller and not bigger. You don't want to see more redness, particularly streaking down your hand. That means that the wound is infected and you need to get antibiotics for that, either in the ER or in the next day or two with your family doctor. You can put the polysporin on it every day. The other thing you want to do is keep your arm elevated as much as possible. So you pretend you're the queen, you've got your arm up as much as you can. You pretend you're waving at all your friends as you're walking. When you're sitting having lunch, keep your arm up like this. When you're going to sleep, put your hand on a pillow so that it's draining away. You want gravity to pull away all the swelling so that it can heal faster. So keep your arm elevated as much as possible. That, along with the polysporin, is what you can do to make sure you heal quickly. Do try and keep it relatively dry. You can shower as usual, get a bit of water over the area, but you don't want to soak your hands in water. So you don't want your hands in a bath where your fingers are immersed in water. You don't want to be washing dishes where your hands are immersed in water. So do try and keep it relatively dry as much as possible, and expect that it's going to take up to 6 weeks to heal. Reasons to come back to the emergency room are if there are pus coming from the end of the wound, if there is spreading redness or streaking redness down your hand, if you develop a new fever, that would be 38.0 in Celsius or 100.4 in Fahrenheit, or item number 4 would be if you have persistent bleeding from the wound. No matter how much you're pushing on that dressing, it's still bleeding, bleeding, bleeding. Do try for 10 minutes, and I want you to set the alarm clock on your stove to 10 minutes and push down hard for 10 minutes. Usually that will treat almost anyone, but occasionally with fingertip amputation there's an artery that's been hit and it may not stop. So do try that a couple of times, and if that doesn't work, come back to the emergency room. I'm Dr. Atzema, and those are my discharge instructions for a fingertip amputation.